Well, I think what I love about being a doctor, but more importantly, orthopedic surgeon, especially with a sports medicine practice, is being able to get people back as quickly, as safely as possible to either their sport or to work or whatever injury that they might have. There's a certain gratification when I'm on the field and I see a kid that I maybe fixed his ACL or did his labral repair and he's doing great, or he or she is doing great in their respective sport. And then oftentimes, which is really great, after the game, I'll come up to them, give them a high five, and that, to me, that's what it's all about. I treat my worker comps cases like my athletes. I try to get them in, I try to identify what the problem is as quickly as possible. I try to figure out whether they need therapy, surgery, and then ultimately get them back to work like I would getting them back to the field. So in essence, I consider them my industrial athlete. So, you know, it's also very gratifying because a lot of times those folks are working, they have to get back to work, they have to feed their families, they have bills, and they're looking to have a surgery and get back as quickly as possible and safely as possible. And I think that's also something that I enjoy, trying to get them back and making them happy, making them feel like they got something out of the whole situation and they're back to where they were and able to be productive again. So in my mind, the benefits of being a private doc is that I tend to do things, I want everything done yesterday. I grew up in Los Angeles, I trained in New York City, and I try to take care of that patient like I want to be taken care of or my family wants to be taken care of. In terms of my practice, I always try to speed the process along. I like to get patients in that day or the next day, and once I see that patient and identify a particular problem, I like to get an MRI or whatever I need to get as far as diagnosis quickly. If they need therapy, get them into therapy. If they need surgery, then we schedule that. So I try to speed up the process so then in turn I can get them back quickly to the things they want to do, whether it's sports or getting back to work or what have you. In regards to second opinions, I always think it's a good idea to get a second opinion, especially if you're not sure. If you're not sure of your diagnosis or it hasn't been explained to you or any issue, and or you just want to find out more information, I always think it's a good idea to get a second opinion. And in fact, if I have my own patient that looks at me and doubts maybe what I'm saying, I oftentimes will tell them, I think you should get a second opinion. And I'll send them either to my partner, Mike McGuire, or I'll send them to another doctor that I know and trust to get a second opinion and see what they think. I think it's worthwhile. The most challenging thing about being a surgeon is you're under pressure. Whether that patient is a recreational athlete or whether they're a worker or a professional athlete, they're relying on you to get them back to whatever they want to do. And so there are different types of surgery, and each surgery has different complexity. And some of the things that when we're fixing someone, the challenges are is that you're wanting to be a perfectionist and you're really trying to do the best you possibly can. So I think it's pressure that for myself I put on myself to try to be the best. And so it's the challenge of getting through that case and being happy at the end of the day. The most satisfying thing really is getting them back to whatever they want to do and hoping that they're happy at the end, that it was all worth going through the process. Because when you come visit the doctor, it's a little scary. You don't know what's going to go on, you're hurt, you're thinking about all these different things, whether you're an athlete, about your playing time, are you going to lose your position, are you going to be able to get back and play again? As a worker, are you going to lose your job, are you going to be able to get back and do the things you have to do, pay the bills? So I think they come in with some apprehension, and if I can alleviate some of that and also help them get through the process, because I consider myself as a surgeon, but also as kind of a coach, trying to help them get back, because I have patients that get down on the dumps because they're not back to work or they're not back to playing sports, and it's a process, and you have to encourage them and keep them going and tell them that there's a light at the end of the tunnel and they'll get there, and eventually they do. And then once they do, I think they're very appreciative of it. I'm also a program director for orthopedic residents. So basically, I teach young orthopedic surgeons how to be orthopedic surgeons. They go through a 5-year residency in which they rotate with various doctors that I select for their education, but they rotate with me in my office and in the surgery center to do sports medicine type cases, mostly arthroscopic cases. In addition, they also get a fellowship experience where they're covering a college team, high school teams. I kind of feel this is my way of giving back to them, giving back to the profession, teaching young people. I've been doing this for almost 20 years, and I think I've gained a few pearls of wisdom here and there that I can share. And if I can make someone a better surgeon or a better doctor, and then it pays off in the end, that makes me very happy.